Ampera dalfampridine is the first and only medication shown in 2 clinical trials to improve walking in people with multiple sclerosis or MS. This was demonstrated by an increase in walking speed. Ampera is not a disease-modifying treatment for MS, and it is not meant to replace your current MS medication. It can be added to your current regimen. Ampera is provided in tablet form and is taken by mouth, so there is no need for infusion or injection. As you learned in the previous chapter of this DVD, MS can damage myelin, the protective coating of nerves, which can cause potassium channels on the nerves to open up so that the potassium leaks out. This can weaken or distort the signals being sent from the brain to the rest of the body, which can cause walking impairment in some people. Ampera blocks potassium channels to enhance message conduction. How Ampera works is not fully understood, but it is thought to enhance signal conduction in the nerves where myelin has been lost or damaged. Ampera does not work for everyone. Individual results may vary. In 2 clinical trials, 35% and 43% of patients taking Ampera responded to treatment versus 8% and 9% of patients taking placebo. In these clinical trials, patients who walked faster regardless of treatment also saw improvements in their walking-related activities. This was shown using the 12-item Multiple Sclerosis Walking Scale, or MSWS-12. This scale is a self-assessment tool people with MS can use to rate the impact of MS on their walking. It covers the following 12 areas: standing, maintaining balance, ability to run, climbing stairs, need for support, walking distances, moving around the home, effort needed to walk, concentration needed to walk, ability to walk, walking speed, and gait, or the pattern or style of walking. Some people taking Ampera notice an improvement in their walking within a few weeks. Others notice improvement up to 6 weeks after starting. You can keep track of any changes you may notice in your walking with your personal progress tracker and in your walking journal, both available in your Ampera Welcome Kit. You can also use these tools as a reminder to keep me and the other members of your healthcare team informed about your progress and about any concerns you have.
You should not take Ampera if you have ever had a seizure or have certain types of kidney problems, or are allergic to dalfampridine, 4-aminopyridine, the active ingredient in Ampera. Your chance of having a seizure is higher if you take too much Ampera or if your kidneys have a mild decrease of function, which is common after age 50. If you have a seizure while taking Ampera, stop taking it and call your doctor right away. Ampera may also cause serious allergic reactions. If you are pregnant or plan to become pregnant, you should tell your doctor. It is not known if Ampera will harm your unborn baby. If you are breastfeeding or plan to breastfeed, you and your doctor will need to decide if you take Ampera or breastfeed. You should not do both, as it is not known if Ampera passes into your breast milk.
You can take Ampera no matter what type of MS you have, and you can take it with other medications for MS. You should take an Ampera exactly as you were told. Take 1 10-milligram tablet of Ampera twice a day, about 12 hours apart. You can take it with or without food. Do not take more than 2 tablets of Ampera in a 24-hour period. This may increase the risk of seizures. If you miss a dose, don't make up the dose you missed. Take your next dose at your regular time. Because Ampera is released slowly over time, you should take it whole. Do not break, crush, chew, or dissolve the tablets. If the tablet is broken, the medicine may be released too quickly. So if you cannot swallow the tablets whole, please let us know. You should store Ampera at temperatures between 59 and 86 degrees Fahrenheit. Throw away any Ampera that is out of date or no longer needed and keep it out of children's reach. The most common side effects associated with Ampera are urinary tract infection, trouble sleeping or insomnia, dizziness, headache, nausea, weakness, back pain, and problems with balance. These are not all of the possible side effects of Ampera. Please let us know if you have any side effects that bother you or that do not go away. You may also report any side effects you experience to the FDA at 1-800-FDA-1088.
Important safety information. Do not take Ampera if you have ever had a seizure, have certain types of kidney problems, or are allergic to dalfampridine, 4-aminopyridine, the active ingredient in Ampera. Take Ampera exactly as prescribed by your doctor. Before taking Ampera, tell your doctor if you have kidney problems or any other medical conditions, are taking compounded 4-aminopyridine, are pregnant or plan to become pregnant. It is not known if Ampera will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Ampera passes into your breast milk. You and your doctor should decide if you will take Ampera or breastfeed. You should not do both. Are taking any other medicines. Stop taking Ampera and call your doctor right away if you have a seizure while taking Ampera. You could have a seizure even if you never had a seizure before. Your chance of having a seizure is higher if you take too much Ampera or if your kidneys have a mild decrease of function, which is common after age 50. Your doctor may do a blood test to check how well your kidneys are working before you start Ampera. Ampera should not be taken with other forms of 4-aminopyridine, 4-AP-fampridine, since the active ingredient is the same. Ampera may cause serious side effects, including severe allergic reactions. Stop taking Ampera and call your doctor right away or get emergency medical help if you have shortness of breath or trouble breathing, swelling of your throat or tongue, or hives, kidney or bladder infections. The most common adverse events for Ampera in MS patients were urinary tract infection, trouble sleeping, dizziness, headache, nausea, weakness, back pain, and problems with balance. Please see Patient Medication Guide for complete safety information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.